What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Why did the dust bunny fall in love with a Roomba? It was swept off its feet. What do you call a muddy chicken that crosses the road twice? A dirty double crosser. What do you call boogers on a diet? Slim pickings.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve, and my little pal, Dr. Scott, the traditional Chinese medical practitioner, gives me street cred to whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we got Tacie, my partner in all things. Hello, Tacie.
What's up?
This is a show for people who would never listen to a medical show on the radio or the internet. If you've got a question you're embarrassed to take to your regular medical provider, we can't find an answer anywhere else, give us a call, 347-766-4323. That's 347. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on the show without talking it over with your healthcare provider. All right. Very good. How's that taste?
I don't know.
Well, you don't like it when I list off all the people you're supposed to consult. Never mind. Don't forget to check out stuff.drsteve.com, stuff.drsteve.com for all your Amazon needs. And check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And check out Tacie and me at patreon.com/weirdmedicine. We're going to have a very special guest this weekend who promises not to fink out on us for the 3rd time.
Yeah, mm-hmm.
And that will be really good at patreon.com/weirdmedicine. And if you want me to say fluid to your mama, go to cameo.com/weirdmedicine. And for almost next to nothing, I will say basically anything you want.
Literally, almost next to nothing.
For real.
Literally anything you want.
Yeah. All right. Except, well, there are certain things I won't, but mostly anything I will. All right. Dr. Scott, I understand that you... Oh, well, wait a minute. We have an update.
We have lights.
Yes, we have lights, but we have an update. And you had your colonoscopy today, is that correct?
I had it this morning.
Yeah.
So for the 2nd straight week, yes.
Now, let me ask you this. Did you have it with without anesthesia?
Negative.
You get nothing. You lose. Good day, sir.
Well, that's because you're an idiot.
Okay, so anyway, really?
I went for the juice, man.
So did you even think about it?
No. Hey, listen, as raw as my ass was after all that nonsense,
Enough is enough.
Enough is enough. Put me out and make it
You
go
are
away.
one pathetic loser.
So you did the propofol.
Did propofol, yeah. So I'm on my second straight week of a propofol buzz. So
and then against their advice, you drove yourself over here. Is that correct?
For the second straight week.
For the second straight week. That's correct.
I am too smart. I am too smart. I am too smart.
That is against medical advice.
Marchi.
Okay.
That is correct.
God.
That is correct.
He didn't even drive the truck this time. He drove the car.
I drove my car, yes. I drove slowly.
So you're hepped up on post-propofol.
Prop, yep.
The prop. Michael Jackson's Magic Milk.
Golly, I can't even imagine doing
It's
that
the best stuff
on a
though.
regular basis.
Oh, every night. Yeah, I did every night.
Holy moly. Yeah, it's just crazy. I was talking to CRNA this morning. and
tell everybody what a CRNA
yeah, so
is.
she's a certified nurse anesthetist, an RN that went back to an anesthesia school, and she was fabulous. But we were talking about the difference, and Dr. Steve can speak to this much better than I can because he's been around a lot longer than me. But the days prior to propofol, the challenges of doing these procedures and the medications and et cetera. And, now you put a line in. As soon as it hits your bloodstream, you're out.
Yeah.
They stop it, and you're awake in 4.5 minutes.
Yeah, it's amazing.
4.5 minutes, yep. with very little residual. So and before that, it was.
Yeah, go ahead.
Well, no, I see. I don't know really before this what they used.
Well, they used benzodiazepines, like Verse said. Back in my day, if we wanted to do conscious sedation on somebody,
ether.
You can.
Oops, I'm sorry.
I'll give you one of these.
Give yourself a bill.
That's the correct one.
That was funny.
That was funny. We would, I have a good story about ether. By the way. But we would use Valium. You would just give somebody 5 milligrams of IV Valium, and you could basically do anything you wanted to them for about 10 minutes.
Right on, okay.
Not me. That wouldn't do anything to me.
I think it's called tolerance.
Tacie, yeah. Tell them how much Valium you did before our wedding.
I can't remember, but it was up in the 20s or 30s.
Oh, my gosh.
Oh, it was the funniest damn thing in the world because...
And you were still functioning.
Yeah, why not?
Oh, man, that's incredible.
Yeah, Tacie was late for our wedding.
Mm-hmm.
And the funny thing is that every time we would rehearse our vows, like a big sap, I'd start crying.
Right.
In the middle of the vow. and I was talking to the preacher. I said, how in the hell am I going to not cry? He said, oh, you'll be fine. You'll be fine. It's like, no, I won't. Every single time we've done this, I've cried. And so we had music, and we had Elvis singing his gospel music.
Yeah.
I believe that every time a baby cries, that kind of stuff. And then we had the Preservation Jazz Band.
Oh, wow.
And so they were alternating. And I had a cassette tape. This was back 21
years ago.
Yeah, 21 years ago.
Mm-hmm.
Yeah, we just had our anniversary.
Hooray.
Sorry.
Too long.
Hit the wrong one. I said, hey, Tace, am I going to get lucky on my anniversary? And she said,
You get nothing.
So anyway, we had this cassette, and they played it, and I'm sitting in the narthex, right? Yeah, off the side of the where the podium and all that stuff is. And I'm sitting over there, and I hear the tape play all the way through, and I know it's coming. And we had a 3-piece band that was going to play music, and they were from our church, and they were really good musicians, and they were going to play as soon as that stopped. And that was going to start the ceremony, and then I was going to walk in, and then Tacie was going to come in, all that stuff.
Okay.
So the cassette ended, and I'm like, oh, here we go. I hear old crying Steve.
Weepy Steve.
Yep. Is going to be in full effect, and no music from the orchestra.
Oh, shoot.
Nope. And then there was no music from the orchestra.
No bride in the church.
And then there was no music from the orchestra.
Oh, no.
And then there was no music from the orchestra. And then in exactly the amount of time it takes to rewind a cassette tape from end to the beginning, the music started back over again from the beginning. And I started laughing.
Listen,
I said, oh my God, she is late for her own fucking wedding.
It wasn't my fault.
Yeah, it doesn't, right. That
And
matters.
nobody wants to hear that bullshit about our fucking wedding.
No, it's hilarious.
21 years ago.
Anyway, so when she finally did show up and the whole thing went through, it changed my mood, because I was laughing about her being late. It was so typically Tacie back then.
I'm not late.
No, back then it was typical in the sense that you were an iconoclast.
I don't even know what that means.
You didn't do things the normal way. You were tearing down icons.
Oh, yeah, that's me.
And
tear shit down.
Mm-hmm. And anyway, so yeah, and it broke my mood, and I didn't cry through the vow. So there you go. That's all. And Tacie was hepped up on 30 milligrams of Valium. So I wonder if I gave it to you IV though, if it would work, because you get a bigger peak.
We can always try it out, sweetie.
I'm willing to try it in here with your tolerance the way it is. Do that as an experiment one day. We used to do experiments in here. We don't do them anymore. Now it's when you do it IV like that, it's in and out pretty quickly. Although diazepam is one of the longer half-life benzodiazepines, so it would still last for a while. But that particular effect really just lasts through the peak. So anyway,
that's crazy.
All right. But, so back in the day, we would do things like that. Now, that was in the 80s. And then they were using Versed, which is midazolam, which is a very short-acting benzodiazepine. Mm-hmm. It's a Valium-like cousin. And then they also used fentanyl,
right,
which was now which is an opioid that's fat soluble that you can run in and run out pretty quickly as well.
Okay.
But the after effects of all these fat soluble medications can persist for a long time. That's why they tell you with the propofol, you think you're done, but you're not, because it's still leaching out of your fat cells.
Right. And I've got lots of fat cells to leach out.
Well, we all do, especially after COVID.
Especially in this old age, yeah.
All right. Well, very good. Well, I'm glad you got it done.
Well,
and what was the verdict?
And the verdict was everything looked super great. I had one small polyp they removed, but he said it was clean as a whistle, no trouble. And scheduled one more in 7 years, so that's a good sign.
Really?
Yeah, that's a really good sign, yeah.
What were they looking for?
You
had the belly pain.
Yeah, just that abdominal pain.
Okay.
Yeah, I think diverticulitis and stuff like that, but nothing showed up. So that's great news. And he and I taled about what you and I talked about last week.
Wow, that is very interesting. Please tell me more.
Sorry.
About the efficiency and efficacy of the biopsy to diagnose Barrett's esophagus.
Yeah. Oh yeah. And what did they say?
He said, he goes now we can actually get a good look at it, where they used to be just eyeballing and say, it looks like it probably is.
I gotcha. Yeah. Well, you need to do a biopsy, look at it under the microscope.
Yeah.
So I wanted to bring this to your attention.
Yeah. What you got?
I have peripheral neuropathy.
Yeah. Oh, wait.
I got every.
You've got the white oil, man.
Well, yeah, I got every damn thing.
Cool.
But I mean, disease-wise. White oil. You mean the stuff I'm holding in my hand? Yes. So one of my patients actually said, and they had, a similar thing, that go get the white flower oil from Amazon.
Yep.
So I got this stuff, and then I look at it, and this is some Dr. Scott shit right here.
It is, yeah. It sure is.
It says active ingredients, camphor, 6%, menthol 15%, methyl salicylate 40%, but it's got Chinese writing all over it. Mm-hmm. And it says Ho Hin Pak Fa Yao Manufacturing in Hong Kong. So anyway, tell us about this stuff.
We use this. Did you show it on the?
No. This is an audio thing. It's, we got 3 people watching this.
That's true.
I'll show it to them.
No, the white oil is something we use as a topical.
Yeah, that's what this is.
As a topical analgesic, quite often for neuropathies, any kind of post-surgical pains, etc. I don't use it a whole lot in my office.
Actually, I think we just went full circle. I think you're the one that told these people about this.
Probably so. Yeah, we used to use it a lot. But what we suggest people buy it at Amazon or where after they go
like
Dr. Steve's.
$6.
Yeah. and buy it that way. It stimulates the nerve endings, and but the only problem is it's got kind of a strong odor.
I don't care.
So but in my office, if you use it all day long, it kind of stinks. So we don't use much.
No, just sell it to them.
Yeah, but it's a one. Yeah, that's why make $1. I put it on my Simply Herbals dot.
But I think camphor and that kind of stuff. I mean, I grew up smelling that stuff, so to me, that's almost comforting.
Yeah. But to a lot of people, it's a little.
Yeah, I guess that's probably true. But
yeah, it's wonderful for pain, for arthritic pains, tendinitis,
well, what I'm going to use it for is at night. After I'm done being active, and if Tacie and I are watching the tube or something, I start getting the paresthesias, aka the pins and needle, in my feet. And as soon as that happens, I'm going to because it is very distracting.
Yep.
So I'm wondering if this stuff actually has a direct analgesic effect, or does it work more like some of the theories for acupuncture, that you are fooling the brain by using a less noxious stimulus that fools the brain into paying attention to that and forgetting about the more noxious stimulus.
I think
that's one of the theories that,
Yeah, yeah, for sure, yeah, because the acupuncture needles are noxious stimulants. But all we're trying to do is we're trying to...
You're distracting the pain center of the brain to look at this other thing.
We're sending stimulation to the dorsal column of the spinal cord.
Yep.
To hopefully send so much in there that part of the spinal cord gets blocked, so it can't receive the nerve impulses that you're getting from the neuropathy.
Yeah, so you're using a smaller stimulus to block a larger stimulus.
Yep.
So, I like the idea. It certainly makes sense to me. Whether it's true or not, I don't know.
Yeah, and I don't know about it being a true allergy. If it had oh gosh, what is it? Clove oil or something? And we know for a fact it's been studied as.
Well, we know that from Marathon Man.
Yeah,
and I don't want to have any spoilers, but if you've never seen Marathon Man, you'll see the efficacy of clove oil.
Yeah, it actually does work, and actually you could use it to anesthetize fish.
What?
Like if you're going to transfer fish, you can put a couple drops of clove oil in it, kind of sedates them, and you can take them into a new tank
really?
or whatever.
And that's okay to do that?
Well, in small doses.
Fair enough.
But you didn't hear it from me. You didn't hear it from me.
Yeah, we'll have
I'm not a veterinarian.
Veterinarians calling. God damn it!
You just killed a fish, you jerk.
All right, well, you've got some stories, and then we've got some questions. Oh, we should probably talk about monkeypox. It's been in the news.
Yeah.
And I'm going to try to do this in such a way that somehow the YouTube algorithm, we don't even publish this on YouTube. People go, oh, he's got 6 people. No, we do the YouTube thing just so that we can talk to people who are interested in watching us do this live. This is a show that we do, on satellite radio, and then we also have a podcast. That's what we're interested in, where we get our views and our listens. But it's still YouTube. If I put these things private and I say the wrong 2 words together in the same sentence, it's a big rigmarole. Mm-hmm. As you know, we had one taken off because I used the I word and the C word in the same sentence.
I know.
And it took almost 4 weeks to get that video back.
Yep.
And it's still private. I'm not going to publish it anywhere. But anyway, it just pissed me off. So there are quite a few more confirmed monkeypox cases than there were last time we talked. Matter of fact, it's probably 300% more than it was last time we brought this up. There are 3,591 as of today, July 26th, in the United States. Now, as far as a percentage of the population, it's freaking trivial. Let's ask Echo what that actually is. Echo, what percentage of 350 million is 3,591? Let's see what
3,591 is 0.001026% of 350 million.
Okay, so we're a very very low penetration, and the thing I'm interested in is the reproductive rate and how fast this thing is growing. Is it growing geometrically or is it growing linearly? I'm going to have to sit down with these numbers and go back and I'm not trusting anybody else's graph. I'll make up the damn numbers myself, and we'll make a graph and I'll publish it. If I have to do a monkeypox situation report, I will. So there are some states that have no monkeypox. Right now, Montana and Wyoming are both of those. Most have a smattering. California has 356 cases. Let's see if anybody else is beating them. Illinois has 350. Ooh, New York has 900. Yeah, so they are far in the lead. West Virginia has 1, Tennessee 20, South Dakota 1. So the if we do the geometric mean of this, we'll find a reasonable number of probably around 18 per state. If we do an arithmetic mean, it'll be quite a bit higher than that because of the outliers of New York, California, Florida, and Georgia, but and Illinois. We'll keep looking at this. If you want to hear anything about monkeypox, we'll just give you a little summary. Vaccines that were used during smallpox eradication provide protection against monkeypox. So if you were born in a time when they were vaccinating people for smallpox, then you would be presumed to be protected against monkeypox. So that would be me.
Okay.
Because I got my smallpox vaccine, I believe, in I was 8 years old, so that would be 63.
Okay.
So I would have gotten mine in 63. They stopped doing them around 72, 73.
So I probably got one that didn't.
How old were you in 72, 73? Usually
4.
They give them to you. It's close.
4 or 5. Yeah.
Do you have the scar on your shoulder? You can usually tell from that.
No.
I believe that they were giving them when people were 6 or 7 years old, but I'm not 100% sure about that. I'm going to have to go back and look. There's some vaccinologist out there screaming at his or her radio. Because I'm being stupid about that. But I'll find out, and we'll do a monkeypox situation report maybe this weekend on YouTube, and you can check that out at youtube.com/weirdmedicine, I think. But anyway, it's caused by a thing called the monkeypox virus, which is an orthopox virus, and it's usually self-limited in the same way chickenpox would be, although the two are not cross-reactive. It usually takes about 2 to 4 weeks to get rid of it, but occasionally there can be severe cases, and the case fatality ratio is anywhere between 3 and 6%. However, having said that, let's just see let's split the difference. We'll say 5%. Echo, what is 5% of 3591?
5% of 3,591 is 179.55.
What? No, that's not right. Oh, yeah, no, it is right. So have you heard of 150 plus people dying from this?
I have not.
No.
No.
So that calls that into question for me. Now, I have found from Johns Hopkins infectious disease guide that they're saying the virus may be acquired through contact, including intact skin and mucous membranes. Most human infections are believed to be respiratory droplet acquired, which is interesting.
Mm-hmm.
So animal to human transmission is seen following an infected animal. Okay, bites or scratch. Acquisition by human to human is believed to be predominantly by large respiratory droplets, although they may also be sexually transmitted or through social networks. As a large pox virus, it's not believed to be aerosolizable. So you're talking big chunks of mucus, of fluid,
yes.
and secretions. The virus enters the body via broken skin, respiratory tract, or mucous membranes. There have been household and nosocomial, meaning in hospital, transmission described. And there is some risk of what we call fomite transmission. This is where the virus ends up on an inanimate object and you pick it up. It says fomite transmission occurs via contaminated clothing or bed sheets.
That makes it more scary.
Yeah, it does. Although, everything that I've seen, the vast majority of cases are human to human, skin to skin.
Mm-hmm.
So it's very interesting. So that's, symptoms, include rash, and then some people only have a rash. Then they'll have fever, chills, headaches, muscle aches and pains, back pain, fatigue. Sometimes you'll have sore throat with lesions on the tongue and the oral mucous membranes. And then you'll have this rash phase. It usually lasts 1 to 3 days. It usually starts 1 to 3 days after you first have symptoms. And you have a typical what we call viral exanthem, which is, flat red lesions that become like nodules, and then they'll have a base that's narrower than the dome, and we call that umbilicated, and then they'll become pox-like with fluid and pus, and then they crust over. And they're generally painful, and they're in the same stage of development on a single side of the body, so they're all sort of clustered together. And then you'll get enlarged lymph nodes, and then the illness will resolve within about 4 weeks. And again, the mortality data that we have are reported cases from from series in Africa. This 2022 outbreak appears to be milder, though it is capable of severe illness, particularly in the immunocompromised. Now, one of the things I was going to tell you guys is that there are treatments for it. There is a treatment for smallpox, a medication for smallpox that's been licensed for this if you have someone that's at high risk for severe disease. And that would be, again, the immunocompromised. And there's also, we can still vaccinate people if this thing gets ridiculous. And the way that you vaccinate people for this is not necessarily to vaccinate everybody in the country. What you do is you identify a case and you vaccinate everybody around that case. Now, that's how they eradicated smallpox.
Gotcha.
And we'll see if they decide that they want to do that for this. And so you do an epidemiologic approach rather than just generally vaccinating everybody again for smallpox. So anyway, good Lord. There is a newer vaccine based on a attenuated virus that should give lifelong protection against monkeypox if we get that far. Hopefully we will not. But if you have symptoms of this, make sure that you tell your healthcare provider immediately, and they'll tell you what to do as far as isolation.
We do have a good question here about it.
Yep.
Are there long-term side effects that we know of?
Well, assuming that you survive,
get through it, you should be.
Yeah, usually you're okay with this one, and to my knowledge, it's not like smallpox. It causes a sort of widespread scarring and those kinds of things.
Good.
Yeah. All right. Excellent question.
Good stuff.
Yeah. Again, generally self-limited, meaning that it just goes away on its own and you don't have to worry about it anymore. The sort of complications when you get a bad symptom can be pneumonia, sepsis, encephalitis, where it infects the brain, and infection of the cornea, which would cause loss of vision many times. So that's why we have corneal transplants. But so far, I've not heard of severe cases in this country yet. But what we'll do is we'll do a monkeypox situation report on our YouTube channel maybe this weekend.
Cool.
Okay. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to Snacks and Wet Napkins. You know how messy you are.
Dad.
Walmart. Subscribe to your weekly list.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
This episode is brought to you by CarMax. Boldly searching for your next used vehicle? With CarMax, you don't have to settle on anything when it comes to your ride. Instead, steer clear of the ordinary and buy the car that's right for you. Because CarMax makes it easy to stop settling and find a car you'll love today. Start shopping now at CarMax.com. CarMax, the way car buying should be.
What else you got? What are you laughing?
I was just laughing. I thought it was
that's hilarious. Monkeypox hilarious.
2 seconds and it wound up being a wormhole there.
Yeah, a little bit
crazy. Yeah. No, so I've got one of the articles you sent me the other day was pretty good about how different cancer cells respond to drug delivering nanoparticles.
Okay. Yeah. Actually, I think your buddy Stacy Deloach sent that.
Oh, that's right. Oh, good old Stace.
Yeah.
The I wonder where he is.
God bless his heart.
God bless him.
No, he's traveling around. He was in Puerto Rico solving some marine problem down there. Yeah, that's what he does.
Yeah. He's good at those things. Yeah. That is for sure. So anyway,
not saying anything else. He's our friend.
He is our good buddy.
He paid his dues,
and he gave us nice treats, which is really all that matters. So the findings of a large-scale screen could help researchers design nanoparticles that target specific types of cancers. And so what some MIT researchers have done have identified biomarkers that predict whether or not a cancer cell will accept these certain nanoparticles.
Oh, really?
Yeah.
Oh, so you don't waste your time.
Don't waste your time. Yeah, and I think we talked a little bit something kind of similar a couple weeks ago about how some of the newest science, they're able to actually take a sample of your cancer cells and break it down and actually run it through computer algorithms
to look for things that
any kind of medicine. It could be anything from natural medicines.
Well, the thing I'm most interested in, Tace, is to take your cancer cells out and just show it to your white blood cells.
Yeah.
Like giving a dog a sock and saying, go find this person. And then sending them in, just putting them in there and say, go do your thing. And that's actually a marketable system right now.
Yeah, nothing
for certain cancers. They're already using.
Yeah.
So I'm very excited about that. I swear, when we first started the show, I would have said 100 years.
Yep.
And here we are.
Really?
Yep.
Well, I remember when it's been 15 years ago. You said we're probably 50 years, and then it was
and then it was 25, and then it's like fuck, it's now.
That's like right now. Yeah.
Yeah.
But it was just the bottom line is they were talking about 35 different types of nanoparticles and how they interact with up to 500 different types of cancers, and how they feel like that's a great way to target chemotherapy specifically, so they're not so systemic and cause other issues.
And I tell people all the time, if you have cancer, right now your job is to kick the can as far down the road as you can.
Yep.
Because they are literally coming out with new shit every day.
Yeah, every single day.
That's not even an exaggeration anymore.
No.
It's every day. So just, if if your treatment is keeping things under control for now, they might have something 6 months from now that can kick it in the ass. So just hang in there.
Yeah.
All right.
Yes, that's pretty incredible. And I found one too, which I thought was kind of intriguing on a number of levels. Again, cancer news. The holy grail of blood tests could diagnose any type of cancer years in advance.
What? Yeah, well, that would be the holy grail. That's correct.
So, when I first read this, all I could think about was, what's the gal that's gotten, is it all the trouble with saying they had a blood test that could take...
Oh, the Theranos.
Theranos.
Yeah.
I was going to say Steranos, but it's Theranos, yeah.
Yeah.
But this is a little different. This was actually published in July 19th of 2022. They were talking about identifying some RNA or dark matter, and it literally says dark matter.
Dark matter.
Yeah, it says dark matter right here. But it's interesting. They're identifying RNA biomarkers in specific mutations across multiple tumors, including lung, bowel, and pancreatic cancers.
Wow,
which is pretty incredible if you think about it. And
yeah, if you can find this stuff early. I mean, I always tell my patients, if cancer would just knock on the front door and say, "Can I come in?" You could just give it a double barrel shotgun right on your front porch, right?
Yep.
It's like, no, get the hell out of here.
Get out of here.
But what it does instead is it waits till you're asleep and it sneaks in the back window and knocks you over the head with a dang lead pipe. And that's because it's living human tissue inside a living human body. And so early detection, I mean, prevention, the best thing.
Yep.
But early detection, second best.
And I would like to add on top of that today, like I said, they cut one teeny polyp out of my colon, just teeny, and it looked pretty normal if you don't know what you're looking at.
Yeah,
a trained eye.
Yeah.
So thankfully the doctor was able to realize exactly what that is, and hopefully keep me from having many issues anytime soon. Anyway,
Yeah, absolutely.
Early prevention, detection. That's a good thing, I think.
Yeah. Now, what you probably had was a thing called a hyperplastic polyp, and that's just from having giant American turds. Even a pescatarian such as yourself
right.
probably isn't taking in as much fiber as you should be, and you can sort of drag little pieces of mucous membrane from the colon along with those turds. Yeah, and you just stretch them out, and they make a little polyp.
That makes sense.
And those are completely benign.
But
you want to cut them out. And that's the other great thing. Listen, you all, you've heard us talking about colonoscopy. I do mine without anesthesia. Dr. Scott does his with anesthesia. And Tacie is actually due for one.
Have you had one yet?
I have had one.
Okay.
And I
thought you were due.
You're
awful young, yeah.
And well, I had one for constipation. Thanks for bringing it up, Scott. So
you didn't have to tell anybody.
I was giving you a compliment. You're very young.
Anyway, so I asked them if I was due for another one, and they said since everything seemed all right the last
good
time,
for 10 years.
that I was good till 15.
Oh, okay.
But I have a question about for like you know.
Well, I was just going to say before you do that. Get your damn colonoscopy. The prep, you'll feel light on your feet after it's done because you drop about 7 pounds of turds.
Yeah, but your ass is raw as hell.
Nah, not if you do it right.
You should have used those.
Mine was raw.
Flushable wipes.
You should get a bidet.
And I had some coconut oil. I did
get
all
a
the
bidet.
appropriate. I should have purchased a bidet.
But if you'll do this, the thing itself is nothing if you do it with the anesthesia, and it's not much of anything if you do it without anesthesia.
Yeah.
But it really is our greatest tool for preventing deaths from colon cancer, because if they see a pre-malignant polyp, they can just snip it out right then and you're done. It's over. There's no cancer. Anyway, go ahead, Tace. Sorry.
So what if you do, and this is not about me, so don't start your shit.
Oh, okay.
So what if you do have constipation, horrible constipation, and you do have ginormous American turds? Again,
right, not you.
About me.
Right, I understand.
So
no, you have.
Would you expect that person?
You have lovely, perfect flower.
I mean, they're so pretty.
Yes.
What would you expect that person?
They smell like flowers.
What would you expect their colonoscopy to look like? Would they just from that have more polyps?
Yeah, I would expect them to possibly have more hyperplastic polyps, And I would certainly expect them to possibly have more diverticulae. So diverticulae, we haven't talked about this quite some time, so we may have some people who haven't heard this analogy before. But when Scott and I were kids, particularly when I was a kid, our bicycle tires had an inner tube, and then they had which was flexible, and then an outer tube that was more rigid. And the colon is like that too. There's an elastic inner lining and a more fibrous outer lining. And when you have a lot of pressure and you're exerting a lot of force downward and you got big giant American turds in there, what can happen is the outer lining can split. And when the outer lining splits, that elastic inner lining will bloop out, and you'll have these little pockets all over your colon. And that's more often seen with people with, either they've got a genetic predisposition toward diverticulae, or they've had, problems with constipation in the past.
Okay.
So I would expect to see those two things, and maybe hemorrhoids too.
So would that person need to have a colonoscopy earlier?
Not necessarily, because those things, although the diverticulosis puts you at risk for getting diverticulitis, it doesn't necessarily pose a greater risk for all-cause mortality, and certainly not a mortality from cancer. So they should still get theirs at the time when they're supposed to, which is 45 years of age or 10 years before their first-degree relative had colon cancer. Okay. All right. What else you got, Scott?
Well, the only other one that I found I thought was interesting, was a bit troubling to me, was the fact that they're showing that. Oh hell, if I can find the damn thing.
Well, while you're looking for that, I'll play something else.
Yes.
We'll do something a little lighter.
Good.
On our Patreon show, Tacie and I played this, but I don't believe we've played this on the regular show. And Jim and Sam were discussing changing the name of the SiriusXM channel that we're on, which is channel 103. Initially, it was High Voltage, and then it got changed to Opie and Anthony, and then it was changed to, I think for a while there, it was The Virus, and then it was Opie and Anthony, and then it got changed to Opie Radio, and then to Faction Talk. And it is currently Faction Talk, except there's no one from the Faction, a group that's still on this channel anymore. That was Jason Ellis, who I always enjoyed. And now that he's gone, it still stayed Faction Talk, and so they're talking about changing the name of it. And this is Jim and Sam's conversation regarding this.
Dr. Steve.
Yeah, Weird Medicine, the longest running show on the channel, by the way.
Yeah, we've had quite a run. Started the Opie and Anthony show, and then just I'm here now that the summer. I'm available all summer to call in if you need.
So it's comedy during the week, Roland's, and then on the weekend it's medicine and food.
Yeah,
because the other show that's left over from the old days is Roland's Food Court. So that's what they're talking about.
A hell of a lineup.
Comedy Talk is still a better name.
What about Talking Comedy? Talking Funny.
Oof, Talking Funny? That's worse. Much worse.
Yeah, you only have stroke victims.
Talking Funny.
That's pretty good.
We all do wacky
But at least that
voices.
involves like Roland.
Talking Funny. What?
I noticed on the new channel that I'm not represented.
I don't know why they call it that. Yeah, I don't know. Talking Funny.
You think
It's not right.
The weekend hosts get together and have meetings?
Yeah, it's not right. They shouldn't do that. It's really degrading.
This makes this
They have meetings. The Monday through Friday guys are just...
Yes, it's just taking this.
Yeah.
Yeah.
My name for the channel, Talking Gout.
Oh, no.
So there you go. Thank you, Jim and Sam. That made me laugh, and I sent it to Roland. He said, maybe we should have meetings.
That is funny. I think we call it the Weird Medicine Channel. There you go.
Yeah, there you go. That's what it should be.
That's what it
should be named after the longest running show on the channel.
I think so. Just out of just no other better name. But anyway, last thing I had real quick was something that shocked me.
Yep.
When I first read the article, frequent napping may be a sign of higher risk of stroke and high blood pressure.
Uh-oh, Tace.
That's what I said.
What?
Researchers
She was napping.
Researchers found that
She was taking a nap when you read that.
That's kind of what I was kind of getting to. Found that frequent napping may be a sign of higher risks, such as blood pressures and strokes. It suggests that individuals who sometimes or frequently napped had an increased risk of hypertension and stroke compared to individuals who exactly
have sleep apnea.
Or
now
it
you're
could
getting
just be
right.
Yeah, go ahead.
somebody just got retired and maybe doesn't have as much to do.
Wow, that is very interesting. Please tell me more.
Yes, exactly.
That's kind of what I was going to. It's interesting. I think the way they presented it was just trying to shock you.
Yeah,
I'm not bored though.
I know. I'm not you. I'm talking about them.
Bad.
It's
journalism,
It's some clickbait stuff.
Journalism. Yeah.
There are lots of reasons why these two things could be correlated, and it's not the taking of the frequent naps is probably a symptom of their risk for heart attack and stroke, not the cause of it.
Exactly.
And I bet, I'm just going to bet, if you went back and looked at that cohort and found out how many of them actually have sleep apnea, because that'll increase your blood pressure.
Huge number of them. Yep.
And it increases risk for things if it's untreated. So that could be something.
That's exactly.
You want to look at the cohort and see how they divided them out too, because if you don't control for things like obesity and other things like that could lead to things like sleep apnea or just general fatigue, then it's very difficult to make any conclusions from it at all.
Yeah.
What was the actual risk ratio for the people who took naps?
Well, what they're saying, exactly what you're saying, the people that
did it say the number?
Extra naps. I'm looking right now. It was a huge study. It was over 500,000. Let's see. Researchers looked 358,000 participants to study frequency of naps and first-time reports of stroke or high blood pressure.
Okay.
50,000 had hypertension. 4,000 had strokes. Napping is, and the bottom line is what.
Wait, 4,000 out of how many?
Out of those 300,000 had strokes.
Echo. What's the percentage of 350,000 of 4,000?
350,000 is 8,750% of 4,000.
Echo, what percentage of 350,000 is 4,000?
4,000 is 1.143% of 350,000.
1.1. So let's say 1%.
Yeah.
Okay. And that's over what period of time?
Didn't say.
What?
They were 40, 60-year-olds between 2006 2010, so a 4-year period.
Okay. Incidence of stroke in the United States, okay?
Yep.
So the, let me see, what is the incidence of stroke? We'll look that up. Just give me the incidence. Okay, it says every year more than 795,000 people in the United States have a stroke.
It's a huge
number. Hang on. Echo, what percentage of 350 million is 795,000?
795,000 is 0.2271% of 350 million.
So it's 0.2. And this was 1%, so it's like 5 times more risk. So that is something interesting.
Mm-hmm. Yep.
You know, so in their cohort, 1% of their people had strokes. But wait a minute, that was over a 4-year period, though.
Yeah.
Oh.
Yeah. That's it.
We'll divide that by 4 is 0.25. What did she say? 0.22?
Yeah.
No, it's the same.
That's what I was going to say. It's the same. I know it. And that's what throws me off about some of these stupid medical articles. I think they do it intentionally.
Well, what it is you've got a journalist who is not a trained medical person.
Yep.
Who is like, I got to find a story today. Oh, look at this. And then they'll come up. They don't always write the headline, though, so you got to read the article. It's often an editor that makes the headline, and they're the ones that are making it sensationalized.
Mm-hmm.
It's not always the author.
Mm-hmm.
So we got to give them cut them a little bit
wiggle
of slack.
room.
But yeah, 1% over 4 years is 0.25%. This was 0.22% is the natural incidence of stroke in the United States. And that, of course, listen, this is junk statistics too, because out of those 350 million people in the United States, a whole bunch of them are little kids and stuff. So we would have to control for age and things like that. But then that would make it even higher. Yeah. So. Yeah, maybe these people were protected. Actually, if send me an email on that, and I'll by God do the actual statistics on that. I'm going to break it down, and we'll do it. And I'm wondering if that's actually going to show a protective effect when you look at the real numbers. But that would be hilarious.
Yeah, but that's why I brought this in, because it was a kind of a crappy article. But the thing that really killed me was about halfway down. They were talking about they don't suggest people with insomnia take daytime naps because they think it keeps them from sleeping at night.
Well, yeah.
Yeah, well, I sound the exact opposite. If I can take a daytime nap, 15
Say
20
daytime nap 5 times real fast.
No, I can't with my propofol brain, but I sleep better at night because I'm not nervous or anxious or upset that I haven't been sleeping every night.
Okay, well, I got you.
Which is a complete train wreck.
Yeah.
Then, you make yourself stay up, and then
I
you're
understand
exhausted.
what they're saying, though. If you're napping during the day, you're only going to get a certain number of hours of sleep.
Yeah.
And if you do a 2-hour nap,
it's too much
during the day, then you're probably only going to sleep 4 to 6 hours at night.
Yeah, I think they suggest. Yeah, there was a bunch of really misleading information in this thing. Okay. Then they said, but naps that are short are okay, but 2 and 3 hour naps during the day indicate.
Right. So I do.
Person who just got retired.
I do the Thomas Edison naps,
yeah,
where he would. This is I don't know if this is true or not. Where supposedly he would sleep. He would sit there with a pencil in his hand if he got sleepy, and as soon as he dropped the pencil, he'd wake back up again, and get back to work.
Gotcha.
And if you're driving and you're using your eyebrows to hold your eyes open, you have to pull over.
Yeah.
Because one of these times you're actually going to go, sleeping wouldn't be so bad.
Yeah.
And that'll be the end of that. So you have to pull over, get out of the car, go get, a drink or something if you're, at a gas station or a rest stop. But one of the other things you can do is just pull over and do one of those Thomas Edison type naps.
Power nap.
You're talking 5-10 minutes, maybe 15, and then you'll be good to go again.
Yep. Agreed.
I still don't understand. I'd love to get a sleep specialist in here, and they won't have an answer. But why your brain does that to you?
Yeah, it's very strange.
It's one of the first things I talked to Anthony about on the air, if I remember a long time ago, was this business of falling asleep when you're driving. Your brain knows you're going to die.
Yes.
But it does it to you anyway. It's like, why are you doing this? Stop it.
And the crazy thing is at nighttime while you're deep asleep, you'll hear air conditioner kick on or a fan or somebody snoring, and your brain just keeps you asleep.
Yeah.
But if it hears an alarm or a telephone,
that is true.
it wakes you up.
There is something that's remaining vigilant, which is interesting.
Which is so why in the world, if you're driving, does your brain not say, hey, shut something else off?
Yeah.
Right foot or
something.
Testicle or
don't
something. But not
make
the brain.
Me unconscious, you
not the
dumb
brain.
piece of shit.
I know, it's crazy.
Stupid brain.
Ugh.
Anyway, what do you think, Tace? Okay. You got
She's
anything
retired.
else?
No.
Okay. Well, let's do some phone calls.
Number one thing, don't take advice from some asshole on the radio.
Well, I'm doing this. Look and see if we've got anybody in the waiting room with a question.
Actually, we do now. We do now. Yeah.
All right, here we go.
Hey, Dr. Steve.
Hey, man.
This is Jamie in Tennessee.
Can't tell.
My girlfriend says that when somebody farts, that there is shit particles in the air, and I don't believe that.
Right.
And I was hoping if you might be able to clarify that on the radio show.
Hell yeah.
I'll be listening for your response.
All right, my friend.
She's a darn liar.
You are the correct one, but it depends on how you define particles. So when you pass gas, and what you're smelling are not particles of shit, they are gaseous molecules. Now, if you define particles of shit as also being gaseous molecules, then she's right. So it all depends on how you define it. But what people are normally thinking about of particles of shit is, little liquid droplets of fecal matter.
Fluid-filled fecal matter, yes.
Right. And that is not the case unless you have your pants down and you've got a really wet one in there, and you put your ass right in someone's face, and then you let fly, and there's droplets can shoot out. But under normal conditions, what you're smelling is hydrogen sulfide. Methane is odorless and smellless. The reason that natural gas smells the way it does is because they put that smell in there at the plant so that you could detect a leak, because normally you wouldn't be able to detect it because it's completely odorless.
Right on.
And I know natural gas isn't just methane, but methane itself is odorless and colorless gas. So, but hydrogen sulfide, yikes!
Yeah.
It smells. That's the thing that makes rotten eggs smell. And there are other noxious molecules that make fecal matter stink. And even if you just pass air over liquid turds in your colon, they're going to pick up some of the smell of the liquid fecal matter. And then when you expel that gas, you'll just be expelling that gas with those molecules embedded in it. But particles of shit only under the circumstance that I outlined. And normally those would be captured in your underwear, assuming you're wearing something you're not disgusting.
You're not.
All right, what do you got in there? We've got about a minute.
Yeah, Loganfield, real quick. Diagnosed.
Loganfield?
Yeah, Loganfield.
Oh, that's my buddy John.
Yep, diagnosed with thyroid eye disease, been on Tepezza for 28 weeks.
Yeah.
Is having some double vision, and they're suggesting he may need a realignment surgery.
Yeah.
Success rate
so
of that.
The thing is, the Tepezza, that this is a new medication for, it's a monoclonal antibody. And will you look it up and see what its name is? And it is for people who have Graves' disease with exophthalmos. That's where your eyes are sticking out farther from your head than they're supposed to.
Right.
And a lot of times folks will notice they have it because all of a sudden they have double vision. It's about $800,000 a dose. Jeez. Your insurance will pay for it, assuming that you have insurance. Wow. And there is patient assistance and stuff like that. But, if you're supposed to get, I don't know, ask him. I think he got 6 doses, 2.4 million. Yeah, you got it, Tace?
I've got the generic name is teprotumumab.
Yeah.
T.
Yeah, it ends with mab, though, right?
W. Yes.
Yeah, okay. So it is. It's a monoclonal antibody.
Teprotumumab.
I can't. Those damn monoclonal antibodies, you give me a drug name, and I'm used to those, but I still have a lot of trouble with bebtelovimab is the new COVID monoclonal antibody, and it took me about a week to be able to say it properly, and I'm probably still screwing it up. But anyway, to the question about efficacy of the surgery, I don't have data for people with Graves' disease, but I do have data on people who have strabismus, and it's about 80%.
Okay.
Where they'll have return of normal ocular function. So what you got to do, dude, is you got to ask them, what's the risks, benefits, and alternatives to this? What are the odds that I will get a perfect outcome? What are the odds I'll get one that I can live with that'll be better than what I've got? And what are the odds that I'm going to have a catastrophic outcome?
Yep.
And they'll have those data. If I know where he is, and it's a very very advanced medical area.
Yeah, and do you care if I ask you about that, like a neuro-optometrist going and seeing a neuro-optometrist they might have some prism glasses that might help? Possibly.
Yes.
Because prism glasses sometimes, when they're mechanical issues, can actually correct vision without surgeries.
Right, and I have prism in my glasses because I have some deviation myself and some drift. But the thing about it is that what they tell me is that'll make the muscles even weaker, and it can get worse. Yeah. So I'm not an ophthalmologist, but that would be something. If the surgery is not acceptable to you, could they correct your double vision just by using prism? But here's the thing, Scott. He has one eye that's fully mobile, and the other one is mobile up to a point.
Okay.
I'm not sure that prism's going to fix that.
Right.
because his eye will go to the midline and then stop, and the other one will keep going, and that's where his double vision's coming from.
Gotcha.
So it's not like they're both equally mobile, and one is just out of alignment with the other one.
Right on.
So it might help for certain circumstances when he's looking in certain directions, but I don't think that's going to be a real answer for him.
Maybe not, yeah.
So, but he can ask all those questions. And his problem is mechanical. It's not just, a lazy eye and one of the muscles being lazy. You're trying to build it up. So.
Or weak part of the brain not tracking. Yep.
So Graves' disease, a real thing, disease of the thyroid that causes these lots of different effects, but one of them is this, as I said, exophthalmos, and it can be devastating. I know John is a person that runs every single day, and just imagine trying to run with double vision. You don't want to smash into a tree or fall into a ditch or something. So, he's got to get this fixed. Anyway, we had higher hopes for the Tepeza than we got, I think.
Yeah.
We may have John on the air sometime if we do Micro Moog Fest soon. Any other questions from the waiting room, Scott?
Well, we do. We have two. I was thinking maybe we'll do one now and one for next week.
Now.
Yep,
No,
We're going to do it live.
Do it now. Colin.
Fuck it, we'll do it live.
CC, Colin Carnes.
Yep.
Are there any conventional or holistic alternative treatments for brain fog or lack of concentration, et cetera, in autoimmune disorders?
Yeah, okay. Why don't you take that one?
Yeah, I'll take it. So what we do a lot of times for brain fog specifically, the acupuncture seems to work. Again, I haven't seen any clinical studies, but this is an N of one. But I treat a lot of it. We do acupuncture. And I do craniosacral manipulation to help with the blood flow in and out of the brain, the CSF flow in and out of the brain, tends out brain fog.
Okay.
Also, some of the old Chinese herbal medicines are pretty good for brain fog. And
really?
one of them honestly is what we have on Simply Herbals, which is the fatigue reprieve.
Oh,
sure is.
Oh,
because it's got ginseng in it. It's got astragalus in it.
Well, look at Dr. Scott trying to sell something to somebody asking him a legit
but
question.
That's the honest answer.
No, I mean GVAC loved that stuff.
It's an honest answer for brain fog.
Now, if Colin were here, I would ask him, what does he mean by brain fog? Because if it's trouble focusing or difficulty staying attentive, and then I would ask, is it really just been since this autoimmune thing was? Because if you've always had problems with attention, you may just have adult ADD.
Sure.
Yep. Or is it slow reaction times? Or is it fatigue or lethargy? I mean, you got to ask all these
insomnia.
questions.
Sure.
So what everybody says brain fog may mean something different.
Agreed.
But assuming he just means he's goofier than he was and he's not, like you are right now, not as able to do executive processing as he used to, then there's a lot of things that you can do.
Yeah, and making sure that nothing else, and like you said, if it's just since the autoimmune disorder, keeping the inflammation down.
Yeah, and are you depressed?
Yeah.
There are antidepressants that have cognitive improvement parameters. One of them is one called, vortioxetine, Tace?
Yes.
That one has some data that shows that it improves cognition.
Right.
You have nootropics like... I was going to say molnupiravir, but that's not what modafinil, and its newest version, which is Nuvigil. That one is Provigil, and those things have been shown to improve executive functioning in people with sleep disorders, but they've been used in other contexts as well. So, there are lots of just different things. Autoimmune conditions are very well known to cause brain fog, including lupus, chronic fatigue syndrome, multiple sclerosis, and fibromyalgia. And when you have a prolonged attack on your immune system, it can certainly affect your brain functioning. And the treatment for that is to treat the underlying disorder.
Yeah, and what you're saying, absolutely. But they have shown with a lot of those things by increasing sleep and increasing certain vitamins, and Kush says right here, vitamin B, omega fatty acids and vitamin D3 can help.
Yeah, I believe in that. I have no problem with that.
Cool.
So try anything.
Yeah, any damn thing.
But
just keep moving.
Yeah, most of the studies that I'm looking at just say increasing your sleep, maybe trying some of these supplements.
Yeah.
Treating depression, treating the underlying illness are the best way to go. Sorry, I got choked up there for a minute. Anyway, all right. You got anything else, Dr. Scott? Anything else in the waiting room? You said you had 2.
Yeah, I had 2. And then, we've actually got a really short one and a really quick one here.
Okay.
Yeah. So let me find again. That was back a little bit. Oh, here. No. Okay. Give me a second. There's 4,000 on here, Dr. Steve.
No,
Give me a second.
I can show you how to cut and paste them so that you can just put them on your little notepad there. But go ahead.
Put it on your little note.
Oh my God!
Well, he keeps notes of everything we talk about. I'm just saying you can just
no, I know,
cut and paste it and put it on.
Not while I'm answering questions and looking up all that other shit.
I got it.
Hey,
I got
so
it.
anyway, why? So this is from Jeffrey Gates. He's asking about why is a provider's instructions tell him to apply the testosterone cream to his scrotum instead of other body parts.
Why does it or why doesn't it?
Why does it?
It says to put it on the scrotum?
It says...
What testosterone cream is he on?
It says, why does my TRT provider's instructions indicate to apply the cream to my scrotum? I'm not so sure. I'd have to see it.
I want to see that.
Yeah, I do too. I don't know. Maybe it's just so you can massage it.
All of mine always says...
Don't put it on your scrotum.
Right, don't put it on your scrotum because it's got alcohol in it.
Yeah.
And to put it on your chest and arms and your shoulders and stuff.
Yeah, send us a picture.
Let me just look it up. Testosterone.
On your scrotum. I don't know about that.
Applied to scrotum. Let's just look that up. That's easy. Okay. Okay. When prescribed in a cream form with the appropriate base compound, transdermal testosterone can indeed be applied to the scrotum. Scrotal skin is thin, has a high steroid permeability. That I have no question about.
Sure.
So it just depends on the preparation.
Yeah.
What did they solubilize this stuff on?
Right. All right. Last one.
Well, I'm going to read to you from Pharmacokinetics of testosterone cream applied to scrotal skin. And it says here they did 3 single doses of testosterone cream administered in random sequence different days, 2 days between doses to healthy eugonadal volunteers. So these people with normal testosterone. And their endogenous testosterone was suppressed by administration of nandrolone. So they gave them a shot of this stuff to stop their body from producing testosterone for a little bit so they could see if they applied the cream, did it actually do anything? Rather than going out and finding people who already have low testosterone, they just made healthy volunteers have low testosterone for a few days. And it said testosterone administration onto the scrotal skin produced a swift peak, and that was dose dependent, which means that the more you put on, the bigger the peak was, with an increase in serum testosterone, maintaining physiological levels for 16 hours.
So there you go.
We conclude testosterone administration to scrotal skin is well tolerated, produces dose-dependent peaks in serum testosterone concentration with a much lower dose relative to the non-scrotal transdermal route. And I absolutely 100% believe this, that when you're putting it on your chest, how much actually gets, what's the bioavailability once you put it all over the place? Spread it out over your chest and your shoulders and stuff. So putting it on the scrotum, as long as it's not alcohol based, and listen, everybody out there, listen to me, don't just start putting your testosterone cream on your scrotum unless it tells you it's okay.
No.
But if they've put it in the proper base, you can do it, and you can actually use less to get the same amount. So yeah, that's good. I'll buy that.
Hey, you've got a meeting in 3 minutes.
Do I? Nope, it's at 5:30.
Oh, this says 5.
No, it's 5:30. Yeah, we're good. What else you got?
Good.
Is that it?
Yeah, well, the last one was from Kush. We got to get it from Kush. What do we know about autistic catatonia, and are there any other treatments besides ECT?
I don't know anything about it.
I don't either.
Why don't we do some research?
Yeah, let's look that up. Because that's very interesting. I think one of my friends' daughters has that.
Yeah, we know
and I think it's terrible.
Not good.
What I know is you need a neurologist that knows what the F they're doing to treat things like that.
Right on.
That I can tell you.
Yeah, you're run of the mill.
And you may, if your neurologist just wants to do certain things and they're not interested, go to a university.
Yeah, go to teaching place. Yeah.
All right. Sorry, Kish, I don't know the answer to that, but if you email me, I'll get some info. I can be an expert on anything about 10 minutes.
Yep, we'll look it up. We'll look it up.
All right.
I'll cut and paste it.
All right. Well, thank you to everyone. Thanks go to Dr. Scott. Thank you, Dr. Scott. Still recovering from my bronchospasm I just had. Thanks, Tace.
You're welcome.
Can't forget Rob Sprance, this is Tacey's favorite part of the show.
Oh,
Bob
geez.
Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that ghoul girl. All right, I'll just skip to the end. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Now, you know, I'm going to hear from certain people this week. Where's my shout out? Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of
They
Weird
gonna
Medicine.
say something. They gonna say something.
By God, something will be said.